Over 40. 3 mouth symptoms. That could mean an emergency warning. Act now to avoid pain. Now, we all have experienced pain when it comes to teeth. But what if I told you there are some types of pain that may indicate something much more serious? Well, I'm a dentist, and today I want to focus on 3 symptoms that you should never ignore. In fact, if you identify with any of these symptoms, you must act now before it's too late. And I'll explain why later in this video. So, stay tuned. As we age, our bodies become more vulnerable to various health issues, and dental problems don't spare anyone. In fact, many people over 60 experience symptoms they just live with or ignore until it becomes a real emergency. And that's precisely why I'm making this video. Have you ever had an experience where a toothache turned into a nightmare? Or perhaps you've witnessed someone else go through such a situation. Please share your stories below because your experiences might save someone out there. The first symptom is sudden, excruciating tooth pain that doesn't go away with painkillers. Tooth pain, especially when it's severe and persistent, should never be ignored. You see, pain is your body's way of telling you something is wrong and needs attention. Now imagine driving a car that suddenly starts flashing red warning lights. Ignoring those lights could lead to a breakdown and a lot of damage. It's the same with your body. Persistent tooth pain is like a red flag alerting you to a potential issue. This could be due to a number of factors such as an abscessed tooth, severe decay, or cracked tooth. If left untreated, these conditions can worsen, leading to complications like the loss of the tooth or even sepsis, which is a life-threatening condition. That's why it's crucial to pay attention to these signals. Don't let the pain escalate into a bigger problem. Just like you wouldn't ignore a flashing check engine light in your car, you shouldn't ignore severe tooth pain either. So remember, if you experience sudden and unbearable tooth pain, don't hesitate to seek professional help. The second symptom is facial or jaw swelling accompanied by a fever. Now, you might be wondering, what does jaw swelling have to do with my overall health? Well, let me explain. When it comes to oral infections, they don't just stay in your mouth. They can spread and affect other parts of your body, especially when it comes to your face and jaws. These areas are connected to your sinuses and can swell up pretty quickly when there's an infection. And here's where things get interesting. Fever is your body's natural defense mechanism. It's trying to fight off whatever is causing the swelling. So you can think of it as your body's alarm system going off. When this happens, it's essential to take action. Ignoring these symptoms can allow the infection to spread further. This can lead to serious complications such as meningitis, which is an inflammation of the membranes that surround your brain and spinal cord, or endocarditis, which is an infection of the heart valves. These conditions can be life-threatening and highlight the importance of addressing oral infections promptly. So never ignore facial swelling or jaw pain accompanied by a fever. Remember, your body is sending you distress signals that need attention. Take care of yourself. Now, the third symptom is uncontrollable bleeding in the mouth, especially after extraction or without any apparent reason. Bleeding in the mouth, especially excessive or persistent bleeding, can be a cause for concern. You see, our mouths are full of blood vessels, and when they get damaged, it can bleed quite a bit. It's like having a leaky pipe. But if the bleeding won't stop, it's time to call a plumber. Similarly, if you experience persistent bleeding in your mouth, it's important to seek professional help. For instance, after a tooth extraction, some bleeding is normal, but if it continues for an extended period, it could indicate a problem with the extraction site. Similarly, bleeding gums can signal gum disease. Gum disease, if left untreated, can destroy the tissues and bones that support your teeth, leading to tooth loss. And that's not all. Recent studies have revealed a shocking fact. Did you know that there is a connection between the health of your mouth and your heart? Yep, it's true. Certain oral bacteria have been linked to heart disease. This means that what happens in your mouth doesn't stay in your mouth. It can affect your overall health, especially your heart. That's why it's crucial to address bleeding in the mouth promptly. It's not just about keeping your mouth healthy, it's about safeguarding your overall well-being. So please don't ignore the symptom. Get help. So let me ask you a question. When does a common toothache turn into a real emergency? Well, let me paint you a picture. Imagine a small cavity. It might start as a mild discomfort when eating sweets or something really cold. But if left untreated, that cavity can grow deeper. It can reach the nerve of the tooth, causing intense pain and swelling. This is where it becomes a real emergency. Ignoring this pain could lead to the spread of infection to your gums and eventually to your jawbone. And in extreme cases, it might even reach your bloodstream and travel to other parts of your body like your heart. So a simple cavity that started as a minor inconvenience can escalate into a life-threatening situation. That's how quickly things can change. And here's a sobering thought. Untreated oral infections in seniors have been linked to pneumonia, sepsis, and even increased the risk of stroke and heart attack. These are serious conditions that can have life-threatening consequences. A recent study by the American Heart Association found a direct link between gum disease and heart disease. The bacteria responsible for gum disease can enter your bloodstream and contribute to the formation of plaque in your arteries. This can lead to heart disease and increase the risk of heart attacks and strokes. So it's no longer just about toothaches and gum problems. It's about protecting your overall health. Here's what you need to do immediately if you identify with any of these symptoms. First aid for each emergency. Sudden, excruciating tooth pain. If you find yourself in this situation, don't panic. Stay calm and try to locate the source of the pain. Is it coming from a particular tooth? Try rinsing your mouth with warm water to reduce swelling and alleviate some of the discomfort. Next, consider using a cold compress on your face to manage the pain and inflammation. If you have an ice pack or a bag of frozen vegetables wrapped in a towel, apply it to the outside of your face near the affected area for 20 minutes at a time. This can help reduce swelling. Over-the-counter pain relievers can also offer relief. Medications like ibuprofen or acetaminophen can ease the pain. Just follow the recommended dosages. However, keep in mind that these are temporary measures. The most important thing to do is to contact your dentist and seek professional help as soon as possible. Remember, early intervention can prevent the problem from worsening. Facial or jaw swelling accompanied by a fever. When you're dealing with facial swelling and a fever, it's crucial to prioritize your health and seek medical attention promptly. While waiting for medical assistance, you can try to alleviate the discomfort. Rinse your mouth with warm salt water. This can help reduce inflammation and promote healing. Use a soft toothbrush to gently brush your teeth. Avoid using any harsh or abrasive materials. And remember to be gentle since your gums may be sensitive. Uncontrollable bleeding in the mouth, especially after extraction or without any apparent reason. When faced with persistent bleeding, remain calm. If it's after an extraction, bite down on a clean gauze pad or cloth to help stop the bleeding. Apply pressure directly to the wound for about 20 to 30 minutes. If the bleeding continues, seek medical attention. When to call an emergency dentist or go to the emergency room. Well, you should never hesitate to call an emergency dentist or head to the emergency room if you're experiencing uncontrollable bleeding, severe pain, or swelling that doesn't subside with home remedies. Time is of the essence in these situations. Don't wait for things to get worse. So why do so many people just live with these symptoms or simply use painkillers to mask the problem? Well, many individuals over 60 years old develop a tolerance to pain due to a phenomenon known as chronic pain sensitization. You see, our bodies are incredibly resilient, but sometimes when we're faced with persistent pain, our bodies adapt. They develop a tolerance to the pain signals. This means that as time goes on, it takes more and more medication to manage the same level of discomfort. This can be very concerning as it might lead to a dangerous cycle where individuals feel compelled to consume higher doses of painkillers. But here's the alarming part. This tolerance can make it difficult to determine whether the pain is getting worse or if it's just your body's way of coping. It's like trying to drive a car while looking through a foggy windshield. You can still see the road, but it's not clear, and that's why it's crucial to pay attention to these warning signs. Never assume that pain is normal or that you just have a high pain tolerance. Persistent pain could be your body's way of alerting you to a serious issue. Ignoring these signs can lead to the problem worsening and becoming much harder to address. Before I reveal the last and most crucial tip, I want to emphasize that everyday medication can be a blessing and a curse. It can provide relief, but it can also cause dependence and lower your pain threshold. That's why it's vital to have a solid plan in place. Talk to your doctor about creating a pain management strategy. Discuss alternative treatments or therapies that can complement medication. This can help you stay ahead of the curve and ensure you're taking proactive steps to protect your oral and overall health. If you're over 60 and haven't seen a dentist in a while, please consider scheduling an appointment. Dentists are trained to spot early signs of potential issues and provide timely interventions. They have the expertise to assess your oral health and guide you towards a healthier smile and a better quality of life. And for those in the U.S. who don't have dental insurance, there's a safety net. The Health Resources and Services Administration has compiled a list of free and low-cost dental clinics across the country. You can find this list on their website and access essential dental services without breaking the bank. Additionally, many hospitals offer discounted dental services for seniors. Contact your local hospital to inquire about their programs and ensure you receive the care you deserve. Now here's a sobering statistic. Approximately 40% of Americans avoid seeking dental treatment due to fear. Dental fear, also known as dentophobia, can be a significant barrier to receiving necessary dental care. But here's the truth. Dental professionals are trained to work with patients who experience anxiety, and they have various techniques to make your visit as comfortable as possible. Ignoring your oral health because of fear can lead to more extensive and costly procedures down the line. So take a step towards a healthier smile. Reach out to your dentist, explain your concerns, and explore the options available to make your dental visits less daunting. Your oral health is worth it. How to effectively communicate your symptoms to a professional. If you're experiencing any of these worrying symptoms, it's crucial to describe them accurately to a healthcare provider. Start by explaining the type of pain you're feeling. Is it a throbbing pain, a sharp pain, or a dull ache? Be as specific as possible. Next, mention how long you've been experiencing these symptoms and if there's anything that makes them feel better or worse. For example, does the pain intensify when you eat certain foods or when you press on a specific area in your mouth? Also, don't hesitate to discuss any concerns or questions you have. If you notice bad breath or changes in your gums or teeth, bring it up. The more information you provide, the better equipped the healthcare professional will be to diagnose the issue and recommend the right course of action. Remember, effective communication is key to ensuring you get the treatment you need for your oral and overall well-being. Okay, I hope you found this information helpful, and I encourage you to take action if you have any of these symptoms. Now, let's talk about something that might shock you. Did you know that over 40% of seniors who experience symptoms like uncontrolled bleeding in the mouth actually don't seek medical attention immediately? Instead, they wait until the pain becomes unbearable. But here's the thing. Waiting too long can have serious consequences. Let me illustrate this with a story. Imagine a small cut on your finger. You could ignore it, thinking it will heal on its own. But if you don't clean the cut properly, it can become infected. The infection can spread to your bones and even enter your bloodstream, potentially affecting your heart or other organs. That's how quickly a small issue can escalate. Similarly, waiting to seek help for bleeding in the mouth can lead to infection, gum disease, and even life-threatening conditions. It's like trying to fix a leaky faucet that slowly turns into a burst pipe. Taking action promptly can prevent minor issues from turning into major headaches. The cost of delaying help. Now, let's talk about the cost, both financial and health-wise, of ignoring these symptoms. Ignoring symptoms like persistent tooth pain, Swelling or bleeding can lead to more complex and expensive treatments down the road. Think of it like neglecting a small crack in your car's windshield. If left unattended, it can spread and require a complete windshield replacement. Similarly, addressing a small cavity early is much more affordable and less invasive than dealing with a large cavity that requires root canal therapy or even tooth extraction. Plus, the longer you wait to address oral issues, the greater the risk of complications such as infections spreading to your gums, jawbone, or even bloodstream. Treating these complications can be more painful and costly. Moreover, ignoring oral health problems can take a toll on your overall health. Untreated tooth decay or gum disease can increase the risk of heart disease and stroke. This highlights the importance of investing in preventive care. By taking care of your oral health, you're safeguarding your overall well-being and potentially saving yourself from more expensive medical bills in the future. Now, I have a question for you. Which of these 3 symptoms have you identified? And what will you do now to protect yourself from an emergency? Please share your thoughts below because your experiences and insights could help someone else. And if you enjoyed this video, please give it a thumbs up and share it with your friends, especially if they're over 60. Your support means everything to us. Until next time, stay healthy and take care of yourself.